Hello, my name is Celeste Tyrell, and I am ANIA's Director of Online Learning. We're glad that you could join us today. ANIA conducts webinars on topics of current interest to informatics nurses. Participants in today's webinar will need to complete the NCPD, Nursing Continuing Professional Development process by evaluating this webinar at the end and retrieving their certificate of attendance. You will have 6 weeks to claim contact hours and earn your credit. This process takes place online in ANIA's online library. I'd also like to note that we are recording this webinar for members to listen to later, so we encourage you to share it with colleagues. On that note, I'd like to introduce our speakers. Our panel includes the following: Journal of Informatics Nursing Editor and Coordinator of ANIA's Certification Review Course, Elizabeth Elkind, and the following ANIA board members: Andrew Awani, Education Director; Denise Tyler, Secretary; Joseph Cook, Regional Director; and Catherine Taylor Pearson, also Regional Director. You can read their full bios in the upper left corner of our webinar player. On that note, I'm turning it over to them. Take it away.
Thank you very much, Celeste, and welcome everyone to today's webinar on elevating your informatics practice with ANIA and insights from the 2023 ANIA membership survey. We're delighted that you've joined us, and we look forward to sharing how to use or leverage your ANIA membership to elevate your informatics practice. There is an interesting article that was written by Bruce Kasanoff in the Forbes magazine titled "How to Elevate Your Life, Leadership, and Learning." And there are 3 things that he mentioned that I think would be very helpful for us as we attend this webinar. The first item he mentioned is being self-aware, and we appreciate you joining us as part of your journey towards self-awareness and reflecting on your membership with ANIA. We hope that you will find elements that will help you increase your level of self-awareness. The second point he mentions is serving others. Remember to share all the nuggets that you learn from this. We know that in order to reach where we want to in life, helping others reach their goal is important. And the third item he mentioned is reach higher. Do not settle for average or an easy life. We know that as nurse informatics specialists, we've chosen to dive into a specialty area that at times pushes us to reach much higher. So 3 things for us to think about as we go through the webinar and pick up nuggets on the way. We like to touch on our vision and mission because, as you can see, our vision is to be the organization of choice to advance nursing informatics. And you should be seeing some elements of that as we go through and touch on the different benefits of membership. Our mission is to advance nursing informatics through education, research, and practice in all roles and settings. And you can see our values there, everything from advocacy to innovation, integrity, and quality. And our strategic plan is essentially based, as you can see, on our vision and mission. The 3 areas of education, research, and practice as a means for advancing nursing informatics are some of the areas that you will see as we go through and talk through our presentation today and just share some insights. There's no great presentation without a graphic for those who are graphically inclined. And essentially, this, again, is just touching on some of the key elements that comprise the ANIA organization and some of the benefits of membership. And so won't spend a whole lot of time talking through those at this point in time, but all of those ultimately drive our vision. So we know that without a membership, an organization cannot exist. So members of ANIA are the blood of the organization. Leadership, whether it's at the chapter level or at the national level, is drawn from members. And so, as an organization, like other organizations, we don't take our members for granted. And so, our goal is to listen to what our members have to say, whether it's anecdotally, obviously as members ourselves, any items that we find that impact our practice or tools that we feel would be helpful or that we would like to learn, obviously we bring to the table. But the survey is also one of those key tools. And we won't ask for a show of hands of how many people completed the survey, but we do appreciate all those who completed the survey or continue to provide feedback on how jointly we can make the organization better. Not only does a membership survey assess interests, preferences, challenges, and needs, but it also helps the leadership better gauge how we're doing with any initiatives that are being rolled out or ensuring that we're headed in the right direction. And so we'll show you some of the initial results. So just some demographic information. We had from the survey a total of about 257 responses. It was fielded over about 3 weeks. And so you see that the response rate, say that our total membership is north of about 3,100. So about 8-9% response rate, which is essentially pretty in line with most of what you see on average for surveys. You can see the distribution of the length of time that our members have been part of the organization there in the magenta colored graph in the top left-hand side. We see that most of our members have been part of the organization between 2 to 10 years is where we have about 61% or so of our members. We definitely appreciate those who have been here greater than 10 years. And obviously, we welcome those who have been with the organization for less than one. On the right side of that, you can see the distribution of our members falls primarily, and this was a multi-select in the informatics nurse specialist role, and the majority have a graduate degree. So that provides some context to the results as we go through. So we'll touch on some of these membership benefits in terms of what the responses were on the survey and dive deeper into that as we go through the overall presentation. And you also have a copy of this presentation, so you'll be able to scrutinize that further. So we see that education is a key use of, or at least ranked high by our members, and that's on the left-hand side. And we also see that that's corroborated in terms of how our members are using some of the benefits of membership, which are reduced rates. On this next slide, we see that the majority of those who completed the survey belong to a chapter. Those who don't belong to a chapter, the most common reason is either that they were unaware or that none was available in their area. However, for those who said that there was none available, if a chapter was available, they were willing to join. So I think the good news is most of our members do belong to a chapter, and those who don't would be willing once a chapter is formed. And we'll hear more about the Journal for Nursing Informatics, but we can see the majority of comments were positive. as illustrated by the green and blue bars there, on everything from whether our members completing the survey would recommend the journal to colleagues, the length of the journal, and their level of interest in the content of the journal. So we have the ANIA communities, and these two questions we're really looking at how many of our members are part of that community. And so we can see that a good proportion are members of a community or subscribe to ANIA Connect, which is the ANIA communities, and find it valuable. But what we saw in these numbers were the opportunity to do a lot more education around that, and you'll be hearing more regarding that. Like any good informatics organization or any organization in general, we do have a social media presence. We can see that the majority of our members who say that they have a social media handle and are following ANIA, they're doing so on LinkedIn. The red bar there shows that there are a number of members, about 40, so north of 40% who say that they do not follow. And so we'll be hearing more about the social media committee. This is regarding the ANIA conference. The majority said they did not attend the ANIA 2023 conference. And to the right are some of the factors that are taken into consideration when attending conference. And so we know that there's definitely price, sensitivity, location, and obviously the program content is important. And then there are three major committees within ANIA. They're listed here, and it's clear that the best known committee happens to be the education committee, but we do have the social media committee and the research and evidence-based committee as well. And so it's clear that there are opportunities for improvement there. We did include word cloud. We won't spend time deciphering it. Needless to say, there are opportunities to provide additional education. There's a lot of interest in artificial intelligence and robotics, and you can see a number of other topic areas listed as well. And just wanted to share with you some of the other insights that are shared. We can see that there's a great love for ANIA content. I mean, of course, we have to call that out, and that ANIA is an amazing organization, but we don't take that for granted, and that's part of why we're sharing some of these key findings with you. And during this presentation, just sharing some of the ways that our members can further leverage the organizational benefits to advance and elevate your informatics career and practice. So since education is top of mind for all of us and one of the key areas of benefit, we do have webinars such as this that we conduct on a monthly basis. Those are recorded. Those are available on the ANIA online library. And so we have a graphic here just showing the online library. And within if you log onto the ANIA website, top right hand corner in the menu bar, you'll see the online library. And once you click on that, you can sort of see the insert there where you can actually see a list of the upcoming webinars. And part of the role of the education committee is to help source for those topics on our website. And we may show you that a little bit later if we have time. There's a place where you can submit webinar topics. You can email also education@ania.org. And if you're interested in either suggesting a speaker, suggesting a topic, or if you're interested in speaking yourself, we know we have very talented members who are domain experts and subject matter experts, number of areas as well. So we look forward to continuing to deliver premium content that our members want, and definitely the webinars are one route for doing that, and you'll hear of other routes for education as well.
Hi, it's Elizabeth Elkind, and I am the editor of GIN, but also the coordinator for the certification review course. As you can see from the slide, it shows an on-demand certification course that we have, and then we also have the ANIA chapter hybrid offering. There's a little difference between the two. In terms of the chapter offering, we do have a live session with those registered for that offering. So it's an opportunity for chapters to host an educational event and receive credit for that, but also for us to have that interaction with the attendees live and go through questions. And they also have other things that they would like to know about. And when you just do the regular on-demand course, you don't have that opportunity versus with the chapter hybrid. So that's a unique thing about the certification review course options. There is a third option. We do offer it at conference as a pre-session. So if you are really a face-to-face person, that is a wonderful opportunity to get to conference, but also participate in the pre-conference for the certification review course. And with that, I am handing it off to National Conference.
Hi, good afternoon. Joe Cook. I'm the regional director for the central region of ANIA. I appreciate the opportunity to participate in this panel. I was asked to speak about National Conference in relation to education. I think the kind of advertised and marketed benefits of the National Conference are fairly inherent. The double-digit CEU offerings, the crowdsourced topics of interest from previous years, the noted speakers that we have. I chose to personalize this a little bit and talk through how I personally benefited from attending the National ANIA Conference, as well as how my organization has benefited. And so I get the question all the time at conference from my chapters, from those that I work with, is how do we get employers to prioritize investing in us to attend our national conference? And the survey results reflected that it's an issue that employers and organizations are no longer or not as fruitfully as they were funding us financially to attend any conference, not just ANIA. And so a solution that we use at my organization, I wrote formalize the value. I just made that up. But really what it is something very tangible, very quantifiable that we can take back. It's not just what did I learn and putting together a slide deck or a one-pager. It's what am I going to do about it, and how am I going to change my practice? And we even asked that on our evaluations, but we have chosen to formalize that model. So for every conference, not at my organization, not just ANIA specific, but others as well, two things are expected when we return. Is one, I would call like a quick win or a low-hanging fruit, or what can we do now? So that's one thing that we can implement or a process improvement related to the discipline of the conference, in this case, informatics, that can be implemented relatively quickly, minimal resource constraints, minimal capital requirements. And so I'm giving my own personal examples from this year's conference in Louisville over the summer. So for this particular one, there was a session regarding nurse leader dashboards and how to streamline that. And I'm going to oversimplify by it, but it was really about getting the right information to the right group of people at the right time, and then taking that and creating some standard work, standardized processing, and embedding that within nurse leader culture. And so at our organization, I really connected with this session. We have a lot of dashboards. We have unit-based clinical leader organizers, throughput dashboards, quality and patient safety dashboards. And when I attended this session and then went back to my own organization, what I realized is we were in a similar position. We were having our nurse leaders go to 12 different places to aggregate the data they needed for each morning safety huddle. And so we are currently in process. I said relatively quick. We're still in process of it now, creating a nurse leader dashboard instead of a quality dashboard, a throughput dashboard, to just pick out those 6 or 7 things that our nurse leaders need to function on a daily basis. The second is that's expectation of our organization for conference attendance is something related to a multidisciplinary process improvement. This is how do we take informatics and help benefit our organization as a whole. And so there was a really good session that Charla Johnson and Sherilyn Long from our Gulf Coast chapter did regarding the informaticist role in promoting health equity. So to me, and again, I'll probably oversimplify it. What I got from that was just, we all know the regulations surrounding SOGI. We all know how to kind of build it and throw it in. But what I got from Charla and Sherilyn was kind of how to the functional application of those regulatory requirements. How do we embed within the workflow? How do we promote adoption for the benefit of that patient population, which is why the regulations were in place. So that's something we're focused on now. We do have a multidisciplinary task force, and I'll end with this. We give credit when I'm presenting these to our organization. We give formal credit that we got this idea from ANIA. Here's the session, and this is how we're going to adapt it in our own practice. And I'll turn it back over to Elizabeth.
So the Journal of Informatics Nursing. There's a lot of ways you can utilize this journal to enhance your practice, share with your peers. We'll start off with, in terms of practice, there's a variety of different articles in each journal. You'll find case studies, literature review, quality improvement initiatives, clinical practice innovation, and research. So the journal is not just focused on solely research. We are making an effort in really getting outside of not just acute care, going across a variety of different settings where informatics nurses work and do a variety of different things. So it takes a little time, but for those of you who are outside of acute care practice, have you ever thought about sharing? There's lots of things I know you can write about. And if you have any interest, believe me, I am very, very approachable. I do not bite, I promise. Happy to set up an appointment, talk to you, discuss what ideas and outline, get you started. So if you have interest in writing and sharing, we have created a very unique journal and setup with both myself as the editor and the peer review team. The peer reviews are constructive, trying to promote and support you in writing. And once we get you to write, we want you to continue writing, because writing is a process. And the more you write, the better you get. And then we're hoping that the writing bug will pass on to some of your peers and you will inspire them. If you are doing a lot of writing, we're always looking for peer reviewers. So if you'd like to join the peer review team, and that's another way to elevate your practice, become part of our peer review team, please reach out to me. More than happy to have you on board. As far as continuing education, every journal issue has a nursing continuing professional development article in it. So that's another way for you to add for your professional development for work, but also if you're certified, that adds to your certification credit, your contact hours that you need to obtain for either to sit for the certification or for renewal. I've included the author guidelines, so if you're thinking about, maybe I'll give it a try, they're there, but they're on the website. I'm hoping to hear from some of you. I'd love to hear from you. And if you know of anyone who's written in GIN, please reach out to them also. The process is very different and unique, and we really try to make this a positive experience and get you enthused about writing.
So I'm happy to share some of the other organizations that ANIA is involved in. So we have a member sit on the Alliance for Nursing Informatics, or the ANI, and these are all national committees and organizations that make a difference in our profession. So we are about our members and our patients and communities that we care for. We're not just looking at ANIA, we're looking at the big picture. We contribute to the Nursing Knowledge Big Data Science Initiative, and this is a large group of nurses from all different backgrounds and organizations, and they actually come together in work groups to address problems. We're involved in NOAA, which is the Nursing Alliance organization, and it connects elected and staff leaders of other nursing organizations together so we can look at best practices and ideas of how to support our members. So we're always looking out to how can we better serve you. The other thing I'm excited that we're involved in is the Nursing Community Coalition, or NCC, and it includes at least 63 nursing organizations. It adds to it pretty frequently. And they advocate for a wide spectrum of healthcare issues. One of the latest things we've been working for on Capitol Hill is the recognition of the Nurse Corps for the nurses that served in World War II. So it's a very active group, and as you can see, your ANIA members and leaders are involved not just in ANIA, but in outside organizations also to help promote our profession.
Well, thank you, everybody, and thank you, Denise. This next slide talks a little about our social media presence. We do have an active committee, as Andrew mentioned. We currently have about 10 members, and we work very closely with our management company and couldn't frankly do it without their help as well. But we have a big presence on LinkedIn, as many of you may be aware of, Instagram, Twitter, Facebook, and YouTube. And our strategy currently is to focus on the initiatives that are listed on the slides. We've gotten great feedback on Talk Tuesdays, Fact Fridays, Self-Care Saturdays, where we highlight a member and what they are doing. And we'd love to hear from all of you and what you're actively doing to stay well and get that work-life balance you so well deserve. We also do Spotlight Sundays, where we love to hear from members on what your current career is, what path you're going, etc. We have also done a great job with our Diversity, Equality, and Inclusion program, where we highlight all different kinds of specialties and celebrate our backgrounds and all the great things that we bring to our career here. We'd love to hear from you. We always are looking for new members, so feel free to reach out to me as well. We also recently ran a great 5-part series just on tips how to get your resume out there, how to interview for jobs. And so we'd love to hear from you if you have any other ideas as well that you'd like to see on social media. Back to you, Elizabeth.
Thanks. All right. Research and Evidence-Based Practice Committee. I know you're probably scratching your head wondering, okay, she's the editor for GIN and the CRC. Why is she presenting this one? Well, just so you know, I do work closely with some of the committees at times. And right now, actually, the Research and Evidence-Based Practice Committee I'm working with, because we're working on a variety of different activities for GIN in 2024. I wanted to let you know that the committee also does the reviews for anyone, an ANIA member who's interested in utilizing our membership for some research or evidence-based practice initiative. And on the website, and this is actually taken right as a snippet from the website, and the link is included there. There's a process for that. And we want to make sure members are aware of this process so that you can take advantage of it, because some of you may be in school for a evidence-based practice project that would fit really well with the ANIA members. So the guidelines for that are all there on the website, and you're going to be hearing more from the Research and Evidence-Based Practice Committee. So look for them in GIN. And we will keep you posted on some other things that we're looking forward to in 2024.
So one of the newer offerings that we've started with are our guides and toolkits, and those are very exciting. They have information that is shared from experts in the field. Our first one was the downtime preparedness, and we used the safer guides to help guide our development of that. And coming up, we'll have the faculty preparedness. And this is focusing on faculty that teach informatics at a graduate level. And both of these, the downtime is currently available in the store, the ANI store, and the faculty will be coming soon. The other thing for best practices that I've had experience with myself is learning about what they're doing at other organizations at the conference, via webinars, in our journal, in our forums. I've used the forums on several occasions to reach out and say, we're implementing this. I've never done it before. Has anyone had experience with it? Or has anyone done this in California specifically? We're looking to make sure that our new acuity system meets the CMS guidelines. And I've been very, very lucky and pleased with the responses. And it's always nice to have somebody that's done it to learn from rather than trying to reinvent it yourself. The other thing that I really want to say is a best practice is networking. I can't stress this enough. And yes, networking needs to be both internal and external. You have to network and develop those relationships with your peers where you work. But if you're only networking with who you work with, you're really missing out on learning what other people are doing. Many times your organization, my organization, does things one way, and it's always good to find out how other people are doing it. This way may work for us, and we should share it. That's part of the, if you look at the scope and standards, one of the things we're supposed to be doing is sharing our findings, and that's not just within ourselves. That's like if a stoplight was down and not working, I told my family, but not anyone else in the community. We really need to share our wins and our losses. If we only share our wins, other people are going to duplicate what didn't go well, and that's not good for anyone. Again, our organization really wants to look at preparing people other than just our members. And again, if you look in the scope of standards of nursing practice, it is something that we are encouraged to do, to both learn and to share our experiences. And that in itself is a good reason to go to the conference, to be vocal in the forums. I don't know that I would have gotten as many responses I got when I was in need if I hadn't also answered those questions myself. So it's a give and take, and it's very, very valuable.
Thanks, Denise. I think that's a perfect transition to talk more about local resources at our chapter level. We, as the board, and specifically the regional directors, we spend a lot of time proselytizing kind of the benefits of a local chapter. And Denise just mentioned quite a few of them: the regionalized or localized education, the networking opportunities, the ANIA Connect forums. But again, I was going to take this opportunity to personalize it a little bit and talk about why I got involved at the local level. Prior to my involvement with the national board, I was helped start the ANIA of Alabama chapter in 2020. I was new to working in the state of Alabama, new to my organization, and realized that there was no chapter. And there were three primary reasons that I did so, and it's more so for my informatics team than myself. The first, visibility to best practices. That's my "we are not unique" example that Denise really just hit on. It's very rare in 2023 that a healthcare system truly has a unique issue that someone else hasn't tried, failed at, continuously improved, and succeeded. And so what I realized joining my new organization was that my team did not have that support structure or that community-based forum wrapped around a national organization to answer those questions. And so that was probably my primary reason, was to get them visibility to what others are doing, solving very similar problems. We're rarely ever the only one dealing with whatever it is. The second Denise touched on as well, and and it kind of builds off of the first, developing relationships with counterparts at other organizations. And this is kind of we have to act now, but what I really meant was we have to do something example. And so I got the question all the time. There's from my team, my organization, there are multiple large healthcare organizations in our state. And I would get the question when we were encountering an issue: what is X doing? What is UAB doing? It's a very large institution in our state. I know they've encountered this before. My answer at first was go ask them. Like, why are we not collaborating with them, be it formally or informally? And that goes back to needing a forum to do that. And so at that point, and this was mid 2020, what my thought is how cool would it be to create that regional or state infrastructure through the lens of a professional organization that literally specializes in this type of thing in ANIA. And so that was the genesis of my involvement in creating a local chapter here in my state. The third is related to, again, for my team, related to professional development. If you asked anyone on my team a couple of years ago, what does an informaticist do? You'd get a very rigid answer. We do this, we do this, we do not do that. But you ask that same question to 10 different organizations, and you probably get 10 different rigid answers. So that was one of my goals as well, was to broaden their perspective of what an informaticist could be versus just in kind of the silo of what their job description was. And we've had a lot of success here. We're a relatively young chapter. We've been in existence about 3 years now, but connecting with other organizations in our area, I think we've got representation from at least the top 4 or 5 largest health systems in our state that are participatory in our state ANIA chapter. And so that was how we approached it from a local resources and local chapters perspective.
Awesome. Thank you, Joe. So many of you probably might be wondering, what kind of membership discounts do we have? We have full membership, associate membership, and as you notice, you can save $10 if you sign up for 2 years. Senior membership at $75, and we even have student memberships at $50 a year. We also offer organizational memberships. So at the organizational level, for that price it's listed, you can have up to 25 members, etc. So there's quite a bit that's available as far as discounts. Other options we have as well through our many partnerships that Denise also talked about previously. We offer membership discounts for conference, CRC, webinars, toolkits, library. We also work very closely with these other organizations, and they often provide us some type of conference discount or partnership, as you can see. Back to you, Joe.
Thanks, Catherine. I'm going to end with this. There are 1 or 2 more slides, I think, before we get to the Q&A. And I'll preface this slide. This is more of a thought exercise than anything. If I had the answer to every bullet point on this slide, I'd likely be presenting it to Congress and not to you guys. But this is something that I was tasked with by my organization, is how can informatics help and contribute to the industry-wide and organizational-wide challenges that almost all healthcare organizations are facing in this day and age. And we as ANIA talk a lot about growing our discipline out of just EHR and IT support and outside the 4 walls of the hospital. And so the purpose of this, I think, was we have an opportunity to continue to prove value outside of those traditional informatics pathways that we're historically accustomed to. So my top 3, there are many more, than this. I focused, health equity, cybersecurity, workplace violence, clinician. I could go on and on for 10 more minutes with all of the challenges that we're facing. I chose to focus on some these are the ones that keep us in business. I think these are the ones that keep the lights on. These are the ones that our senior executive leaders, our CEOs and CFOs are talking to us as nurse leaders about. And so just a couple, I won't belabor any of these, and I'm kind of going to personalize them to my state as well, which is what I'm more involved in. Clinical labor shortage. We all know about this. And in the state of Alabama, there was an article 2 weeks ago, 39,000 RNs intend to leave the profession in the next 5 years. Couple that with nursing schools, at least here in the Southeast, turning away thousands of applicants, not because they're not qualified, faculty shortages, insufficient clinical placements. How can we, so the goal, and I'll go through a couple more of these, but the goal is for how can we as informaticists, using our professional organization support as well, start to think about unique solutions through the lens of technology, through our backgrounds as informaticians, to help solve these more global problems. The migration of historically hospital-based procedures to outpatient. This is coming, and there will be competition. Private equity is involved with this, partnering directly with physician groups and trying to cut out us in the acute care facilities. How can we maintain continuity of care? I think that comes to mind very quickly as something we could contribute to. Expense structures that outpace attainable revenue. This inflationary pressures. This everything is more expensive now. Salary, wages, and benefits related to the labor shortage. Construction, supply chain, medications, utilities, on and on. The average overnight inpatient stay cost is double what it was pre-pandemic in our state. So we can contribute to that now. There's a couple of flat payer contracts, exponential increase in denials, struggling community providers of care, contracting capacity, all of that. So we are starting to work on some of these as informaticists in my organization. We're trying to help tackle how we frame and support clinical staffing. I have a full-time nurse informaticist that only works on predictive modeling and predictive analytics related to average daily census and that demand for nurses versus the supply we have available in all of our different contingency buckets. And he is solely responsible for kind of playing with those levers of staffing mix and how much more agency do we need compared to the core staff that we have, and what that contingency looks like from our float pools and on and on. So we're trying to start. I think we're early. Some of these other ones I don't have answers to, but I do think we're going to have to start getting involved in broader conversations. Again, we are much more valuable than just governing and managing IT processes in the EHR. I think we're past that. And so this was just meant to be a little thought-provoking. I probably ranted a little bit. I talk about this a lot, so I appreciate you guys sticking with me. Thank you.
Thank you, Joe. And what I really want to show you here from our last published year-end financial report is that we invest in our members, and we are here to support you. As you can see, the bulk of what we do is to support education, products, and membership services. And we will continue that goal.
Thank you, everyone who's spoken. I think just like you said, Catherine, as an organization, we've laid out what our vision is and mission, and it's great to see that everything we've talked about so far works to align with that vision. And I think this question of whether the ANIA membership is helpful in work and or career, we found in the membership survey that at least 95% of members agree, some more strongly than others, overall, that ANIA membership is helpful in work and or career. as an organization, where we were at 5 years ago is not where we were at 3 years ago, is not where we're at now, and will not be where we're at in another, 2, 3, 4, 5 years from now. And it takes all of us to do that. I think that's one of the key messages that I took away just hearing everyone speak around this topic. So I know there was a question, and I think this is probably directed to you, Joe, when you were speaking, but any of our panelists can jump in terms of how do you formalize the value before attending conference so that your organization can fund you, since you can look at some of the topics and descriptions. And so just wanted to open it up to our panel in terms of some ideas, if you wanted to kick this discussion off, in answer to that question by Ashley.
Yeah, I don't mind starting and would welcome the opinions of others as well. I think it's a great question. It's a chicken and egg scenario. And so really, we had good support from our organization. What I would recommend is, what problems are you trying to solve? So especially within your own discipline, what are you having issues with? What are you having trouble taking to completion or getting over the hurdle? And then look, if you're a member of ANIA, you already have access to all of our on-demand resources, all of our forums, everything. I think you can start to prove the value of membership before you can even get to like formally attending a conference. And so how can the on-demand resources, the ANIA Connect forums, help with your existing problems that you have? And then you can start using that as a building block to, we were able to accomplish this. Here's what we're going to do at conference. Think of what that could do moving forward. But other board members can chime in as well.
One of the things I've seen, and this is a little late to the game, I like the way Joe presents that you plan this ahead of time and show the value of the ANIA membership and the different offerings. But if you need specifically to go to a conference, one of the things I've seen both a director of education and a faculty member do is to take a look at the conference and highlight the things that are being covered by the different speakers that are experts and presenting what they've actually done and how that will apply to your organization, to the issues you're having, or to the things that you've got it going, but you need to fine tune it. So they used it for those kind of activities to get funding. And then the other thing, I'll just be honest, I was not always very fortunate with my employers in getting funding. I would be lucky or grateful if they gave me education hours instead of having to take vacation time. Mm-hmm. But personally, it's just well worth it. You can't put a number on the value of lifelong learning and of learning what's going on at other organizations.
And I know for me, I've been at organizations where you have to plan out like a year ahead, what conferences you want to go to. So I either utilize the previous conference year's planning guide to help, extrapolate some themes to help justify attendance too. And along with Denise, yes, I offer to take time instead of money off. That's an excellent strategy as well. But we also offer the hybrid version as well. So that's an option to save on travel.
Thanks, board members, for all those great responses. There might not be a perfect answer, but I think each organization is different. We know organizations are cutting back on a lot of expenses. And so I really like your point, Denise, about sometimes we do need to dip into our pockets in order to, if we've been tracking, to spend some money on really just investing in ourselves. There's a question around how to get more involved at the local chapter level and how to reach out to leaders, and wasn't sure if Joe or Catherine wanted to just briefly touch on that. how to get more involved at the local chapter
Sure,
level.
I'm not sure I understand the specific question, but getting more involved in your chapter or knowing how to get involved with your chapter on our website, on our ANIA.org, there is a chapters page that will list the chapter elected officials locally. Their contact information is there, as well if you're wanting to reach out directly to a chapter leader, as well as the ANIA Connect forums. As long as you're a member of that chapter, you have access to that chapter's website, their ANIA Connect forum, as well as being able to participate in the dialogue that's going on. So I would recommend, as a first step, just cruising the website, logging in, going to your chapter page, looking at who your leaders are and what's going on through your either upcoming events or ANIA Connect. And Catherine, you can add to that.
Yeah, definitely attend events, host an event, whatever you can do to help be a part of everything. I know that a lot of my chapters too, they do a lot of volunteering for the community. So it's not just having a meeting or doing an educational webinar. It's finding a common purpose. So there's so much you can do at the chapter level.
And I really like both of your points. I think one of the things that comes to mind as well is if you feel like your chapter might not be doing something, but you happen to have an interest, just like you mentioned, Catherine, maybe, walk for diabetes, a particular race or some other social event. You don't have to be a formal official or leader of the chapter. You can reach out to your chapter leaders and go, hey, I'd love to organize this for the chapter. So I think there are a number of different ways to be involved. There's a question, I think you like this question, Elizabeth. Are there any scholarships or free opportunities for certification bootcamp / prep courses? Since our organization does not cover cost of courses, books, or additional preparation materials.
Well, we're actually for 2024 going to potentially be offering some scholarships for the ANIA pre-conference certification review course. So stay tuned. You will find out more information as it's available in e-news. So read your e-news for that and for when it's going out, because when we do offer those, it's a short time frame to turn around for those to submit who are interested in applying for that. And you can always touch base with me too, but it would be for the ANIA certification review course, and that would be pre-conference is what we're looking at doing right now, some scholarships.
So I'm going to put in a plug here also. You don't have to only attend events, especially the online ones that are available or put on by your local chapter or the chapter nearest you. One of the things, and I often learn about it, and I probably could learn about it. I want to say I would learn about it in the forums also, but in social media, I just went to attended an online webinar from Tri-Cities this last weekend, and I live in California. So attending chapter events, especially the online ones, also obviously, is not limited to just your chapter. I know many people have attended the CRCs that are virtual, that are maybe the San Francisco chapter offered it, and I live in Florida. I can still attend. That's one of the real benefits of having things offered online, is you can learn if something sounds interesting or if you want to attend. It doesn't have to be at your local offering.
Lisa, I think that's very important to highlight. You're absolutely correct. I think we know we have colleagues that live in one community and work in another, so that you might belong to your local chapter where you live, but in reality you spend more time closer to another chapter, and I think that's very important. There's a question on how often GIN is sent, and go ahead.
It's quarterly. It comes out in March, June, September, and December. and it's all electronic. So it's the online issue. You get notification, and also e-news keeps you up to date when a new issue comes out with the link to it.
Right. And Elizabeth, I think you'll probably relate to this question as well, just because the question is, what do we recommend as an easily accessible platform that contains wide spectrum and comprehensive, up-to-date information? And there was a similar question on how do we stay brushed up on nursing informatics if we've not been in the field for a while, but remain certified.
Well, actually, the webinars are a wonderful opportunity for that, along with the Journal of Informatics Nursing. And then actually when the different chapters, they offer, some of them do regional events where they co-sponsor among a bunch of the chapters from the region. Some of them just do chapter events, and you're welcome to join. Many of them, it's very reasonable or even free. So these are wonderful ways to keep abreast of what's going on.
Thank you, Elizabeth. It sounds like you're ordering webinars as your main course and certification, gin as dessert or as a drink on the side.
Well, actually, if you look at the webinars, between the webinars and gin, if you sign up for all the webinars, now, with webinars, if you can't attend it actually that day at that time, you can still sign up and then go back and access it. Based on just the webinars and gin, you will have enough to maintain your certification every 5 years. So it's a win-win. But there's also other offerings, and conference is wonderful. Conference, I find, is also not only just for seeing what's going on, sharing, but it's also re-energizing. We need to re-energize ourselves. And conference is one place that I just find does that for me and gives me that energy and new ideas, what I'm going to look at for next year or later on in the year. It keeps me moving forward.
Right. We have about a minute left. So there's in the chat there was where can you find info on ANIA related to discounts for the nursing informatics certification renewal, and when you go to renew as an ANIA member, there are discount options, and you can click on that. And I know there are a number of members that have clearly identified that as something that they've used. If you have additional questions, you can email or reach out to any one of us or on the board, or reach out to ANIA as a whole. And there was another comment about it'd be great if local chapter events are advertised nationally across ANIA communities. With the chapter websites, one of the cool things is if you post your event, it gets circulated nationally, and so that's something that is available. Well, we wanted to thank everyone again. Want to thank my colleagues who have participated in just sharing how we can elevate our informatics practice, and just all the wonderful ideas shared, all of you with the questions asked. And let's continue to elevate our profession. We know the future of nursing depends on being more efficient. Like Joe mentioned, there are just not enough of us to go around. So just want to thank everyone again, and just wanted to bring this webinar to a close at this point in time.